Hello, welcome. I'm Dr. Ashutosh Bhatt, and today I would talk to you about ectopic pregnancy. What is ectopic pregnancy? This is a condition that requires immediate attention and can be managed effectively with the right age. Let's dive into its causes and what is etiology. That is the most common question patient to ask us. What is the reason of this etiology and what is the reason of this ectopic pregnancy? Most of all, we should know that an ectopic pregnancy happens when fertilized egg implants outside the uterus. Most commonly, it implants into fallopian tube. And this is not a place for pregnancy to grow, develop normally. So if the pregnancy is at abnormal position, it can lead to serious side effects and life-threatening risks at the time. Now, let's discuss what is etiology of ectopic pregnancy. Most common is a pelvic inflammatory disease. If a patient, she is having pelvic inflammatory disease before pregnancy, like gonorrhea or any other things. So that will lead to damage to the fallopian tubes. That will lead to damage to the cilia which are present inside the fallopian tubes. And those cilia, what they do, they generally push the developed embryo inside the uterine cavity for its natural position for implantations. If there is a problem with the cilia, if tubes are damaged due to pelvic inflammatory disease, infection, tuberculosis, then chances that the female will have ectopic pregnancy or the implantation inside the fallopian tube. Unfortunately, the tubes are not that much expandable to take care of a growing pregnancy. So around 6 to 8 weeks of gestation, the tubes will get ruptured and there is a massive hemoperitoneum or accumulation of blood inside the pelvic cavity is seen. Another thing, if there is a previous tubal surgery or previous tubal damage. If there are some operations on fallopian tubes like recanalization surgeries or any stitches present on the fallopian tube, that will lead to injury to the fallopian tube, and because of that there is implantation inside the fallopian tubes because there are some problems while embryo passing from fallopian tubes to the endometrial cavity. So any condition that narrows or obstructs the tubes increase the risk of implantation of an embryo outside uterus. Sometimes smoking is a factor which causes fallopian tubes to slow down its movement, and because of that there are chances of increased ectopic pregnancy in a woman who are smoking. If there is hormonal balances, if there are some medicines which are used for pregnancies, some extra technologies like IVF, those also may increase risk of ectopic pregnancy. If woman's age is more than 35 years or she has got a prior history of ectopic pregnancy, yes, she might have ectopic pregnancy again this time. So it's essential to recognize signs of ectopic pregnancy. So what are the signs of ectopic pregnancy? That is severe pain in abdomen, vaginal bleeding, dizziness, and urine pregnancy test positive. These are the signs of ectopic pregnancy. You should be knowing this. If you have got any of these signs, you know you are pregnant and there is pain in abdomen and vaginal bleeding. If you see this triad, contact your doctor immediately. Thank you for watching. If you find this information helpful, please share with others. Thank you very much.